Namaste everyone. Myself Dr. Karthik, consultant hematologist and transplant physician working in Shankara Cancer Hospital and Research Center, Bengaluru. So today I'll be discussing about one of the important topics in the field of hematology, and that is lymphoma. So basically, what is lymphoma? Lymphoma is a blood cancer which is arising from a structure called lymph node. So before knowing what is lymphoma, we should know what is lymph node. Lymph nodes are round structures which is present all over the body, right from top to bottom, which is nearer to the visceral organs. So the basic function of these lymph nodes is to capture the infective organisms and kill it. So what happens in lymphoma is the lymphocytes which is there inside the lymph node undergoes some genetic change and it starts multiplying rapidly. So when there is rapid multiplication of the lymphocytes inside the lymph node, it becomes a cancer, and that cancer is called lymphoma. So in simple, lymphoma is a cancer, that is blood cancer arising from lymph nodes. So a person gets lymphoma. So how does he come to hospital? What are the symptoms that he gets to arrive at the hospital? So basic symptoms usually seen are palpable lymph nodes, like swellings seen all over the body, predominantly in the neck region, in the axillary region, in the inguinal region. These are the areas predominantly where they will find new swellings, and they can have B symptoms, kind of fever, on and off low grade fever, weight loss, not able to eat properly, loss of appetite, weakness. So these are all the symptoms which is seen in a patient who has lymphoma, and they come to a hospital for these symptoms. So once they come to our hospital, what do we do next? So we need to confirm whether the symptoms, whatever he is having, it is because of lymphoma or anything else. The first step in arriving at the diagnosis of lymphoma is to undergo a biopsy of the swelling which he has got. So we do a biopsy of the swelling and see whether the biopsy material is showing any cancer cells or any other infective process. So if it is showing any cancer cells, then we have to subcategorize the cancer based on IHC finding, that is called immunohistochemistry finding, where we used to put some antibodies over the cancer cells and we can subcategorize what kind of lymphoma he has got. Because under the classification of lymphoma, there are more than 100 types of lymphoma. Each and every type of lymphoma has its own treatment and has its own prognosis. So we need to classify what kind of lymphoma the patient has got. So once they come to a hospital, we do a biopsy and we should find what kind of lymphoma he has got by doing an immunohistochemistry testing. So after immunohistochemistry, if the pathologist of our hospital, if they say that it is lymphoma, then the next step is to know what stage he has got. Because staging is very important before starting treatment, because number of cycles of chemotherapy for a lymphoma depends on the stage, and also the prognosis of the patient depends on the stage. So we do the second step, which is called the PET CT. So first step was to do a biopsy. Second step is to do a PET CT of the entire body to see where all the lymph nodes is involved, and based on that we will stage accordingly. Now coming to the treatment. So treatment depends upon what type of lymphoma he has got. So it can be a low-grade lymphoma or a high-grade lymphoma. Generally, low-grade lymphomas are treated only when there is any indications to treat. Sometimes elderly people, they come with only swellings in the body without any symptoms. No fever, no loss of appetite, no weight loss, and no weakness, nothing. So in those cases, there is no need to treat. We can just wait and watch until unless they get any symptoms, then we can start the treatment. This is for the low-grade lymphoma. Whereas on the other side, if it is a high-grade lymphoma, we need to start the treatment at the earliest. If we don't do that, then the disease starts progressing more rapidly. Because high-grade lymphoma, as the name suggests, it is very rapid and it is very progressive. So we need to start treatment at the earliest for high-grade lymphoma. So how does the treatment go about? So we usually give 6 cycles of chemotherapy for most of the high-grade lymphomas. And during the chemotherapy, they used to get admitted in the hospital for at least 2 or 3 days, and after the chemotherapy is over, they will be under follow-up in the OPD wise for at least 2 weeks after that, because chemotherapy doesn't know which is good cell and which is bad cell. It goes and kills most of the cells, and even the good cells can die and it will come back to its normalcy. So during that stage, the patient can have some amount of fever, difficulty in passing urine or cough, some kind of infection can happen. So all those things needs to be managed on a OPD basis. So the most important thing over here is when a patient is having any symptom, they should not ignore it. Please come to the hospital, to the nearest physician or the nearest hematologist at the earliest, and start evaluating what is the issue. If it is lymphoma, if it is a high-grade lymphoma, I would suggest to start treatment at the earliest.